2003 is when it really hit. I had caught pneumonia, and they put me in isolation. And I had this one doctor. She didn't have no compassion whatsoever. So when I was in this isolation room, she came in like I don't know what, just very rude, And she goes, "Well, you know you have HIV, right? You can go to prison for this." And I go, "What the hell?" It just blew me away. A doctor, this is a physician, coming at me like that. And which I didn't know, because the prior tests that they did came back negative. And my thoughts in my head saying, "Uh-oh, this is it, I'm going to die."
I am a person with HIV. I'm HIV positive, and I found myself in need of assistance with food and other services. So I came to the Health Trust. It wasn't an easy thing to do. I was working at the same time, and I just thought other people could use these resources. I'm working. Perhaps other people in need could use it. So I didn't really see myself as someone who was like them, so to speak. But I realized we're all people and we all have needs, and the Health Trust exists to serve those needs. So here I am.
One of the largest programs we provide, and we provided long before the Health Trust was even called the Health Trust, is our HIV/AIDS services program. The primary funding comes in part from the Ryan White Care and Prevention Act. We're one of the few remaining, actually, south of San Francisco AIDS service organizations that has assembled such a comprehensive package of services. And it's really critical for our clients to be able to have that one-stop shop where they can come visit staff and they know that all their needs are going to be met in one place. It's really been one of the best models possible in the country, and the results show that it is a positive model in that the majority of our clients do have an undetectable viral load. They do have access to medical care. They do have access to the medications they need, and they have access to healthy food on a regular basis too.
When I saw how warm everyone was and how the volunteers were interacting with the clients and among themselves, it became the high point of my day in a way that I wanted to be there. I wanted to be like that. So when I first started to hear about volunteering, it took me about a year before I could finally try. I find so much value in being here.
I feel that these people care about me, not just as a person, but as a human being. As a human being. If somebody doesn't care, have compassion, they don't care about you as a human being. They're just, like I said, you're just a number.
We take this for granted because that's what we are. But when something like this happens, and suddenly we may be looked at differently or afraid that we'll be looked at differently, there's a loss there. There's a lot of things that can befall people. So it's easier in some ways to not go there. But ultimately, it's more difficult on the person with HIV/AIDS. And it's also more difficult for the family who doesn't know. There's a lot of education out there, and there's a lot of resources out there for people. But fear, I think, is the biggest enemy.
It was tough telling my family, first of all, but I had to get it out there. Yeah, I told my mother. She went to all the doctor's appointments with me, so did my sister. My mother says, "We're going to kick this. You're going to get back to health." So she was a great inspiration on that part, Especially telling my father, But he embraced me. He said, "We'll get through it." thank God for my family. You know, if I didn't have my family, I'd be out in the street. I'd be out, you know, probably buried already. You know.
I'm a long-term survivor. I was diagnosed in 1990. And I've been through lots of ups and downs and all that, but I survived. I kept going. I had a doctor who told me we could try this particular therapy, but it probably would take about 1.5 years to work and you won't live that long, so we'll not bother with that, right? I was very angry when I heard that. I had pneumocystis pneumonia and I couldn't even tell him how angry I was because I couldn't speak. He did me the biggest favor by doing that because it empowered me to take control of my own life, my own health, and go forward.
Now I'm undetectable, so yeah, that's a great thing. You may have a lot of pride, but pride ain't going to get you healthy. All it's going to do is get you 6 foot under. You know, so if Health Trust is willing to put their necks out for an individual like me, and maybe others, that's helping the community.
We know what it takes to stop the spread of HIV. We know what it takes to help people live as healthy a life possible. We know what it takes to help people get to an undetectable viral load, which makes it virtually impossible to spread HIV to someone else. We know all these things now. We're at the point where we need people to get re-engaged in care, treatment, and prevention of HIV. One of the newest initiatives funded under the leadership of Supervisor Ken Yeager, the Santa Clara County Board of Supervisors funded a multi-year campaign called Getting to Zero. This initiative is focused on 0 new infections of HIV, 0 deaths associated with HIV, and 0 stigma associated with HIV. We believe that this campaign will help re-energize people and refocus people and bring people back into this important cause and develop champions that will help maintain services in the years to come.
Yeah, without these services, you'd be out. It's got to help the community to get them informed, be informed. This Health Trust can and will make a difference.
If you are diagnosed with HIV, the world changes completely. The colors are different. Everything is different. The way you see things is different. The way people see you is different. You can see it in their faces. You can see it in the mirror, in your own reflection. You become a different person. Help is what we need. Everyone needs help. People with HIV need help to remain functioning, participating human beings. So let's help each other be the best that we can be. HIV is something that's real. It's not to be ignored. It has an effect everyone probably knows somebody that has HIV. We all need help. Help us. No, let's talk about it. Let's talk about it. It's a fact of life for everyone now, like a lot of other things are. But let's not forget about HIV because it's here and we can live with it. I like to say, yeah, I've got HIV, but HIV does not have me. Big difference.